So thank you for inviting me here, and hopefully this educational quick thought here will help everybody be, I can never make people comfortable, I always say. I just want to give you some confidence to do something. Recognizing that there might be an emergency actually is one of the biggest things that we try to make sure that we get people to understand. Sometimes just a quick, how are you doing? What's going on? And those little things can help us lead to help other persons that may have a medical emergency at the time. So today I actually went, I hope you can hear me okay. I went and got the AED that you guys have in this building. We have in our community multiple AEDs, just to let everybody know. They pretty much work on the same preference, but I wanted to show you a couple of different ones that we do have out there. So I have some information, hopefully, that I can bring up on the computer just to kind of get us going. I think I'd like to play that information for you, unless there was any thoughts real quick for me.
Without a mask.
Whoops.
Look.
Do you think we can hear that okay? If not, you tell me. Okay. So I'm going to play some quick information about an emergency and then what you guys probably, if you've seen this, what you could do. And it talks about the AED. Okay. I guess maybe before I do that, before I preference that, I have some handouts that anybody can have. I'm going to leave extras here. The persons that are sitting with me, I do want to talk about, as we discussed, the difference between a sudden cardiac arrest and a heart attack. And I know it's kind of silly when I say that. You guys have that information, and I'll get one for me to show those persons at home. Thank you. I didn't pick up one. I guess I'll have to have one for me. Thank you. So this information, and I don't know if that's something you can kind of hone in on at all, or in front of the camera. You tell me. You're better off than me than I am. Okay, there you go. So this information is for everybody. There's extra of these little guides here for anybody to take. So what I just want to say is I'm inquiring to everybody, even those persons that are watching, if you were thinking about a heart attack versus somebody that's in cardiac arrest, we kind of say, look at your person and then actually tell me, how do I know which one they're experiencing? Can anybody, just by looking at them? Can anybody understand what I mean by that question? How do you know the person that you're dealing with is either in sudden cardiac arrest or having a heart attack?
We understand the question.
Okay, how do you know? And I'm going to use one word. That's correct. I know, I like that. Thank you. Well, what I want you to understand is when you're looking at your person, when somebody's having a heart attack, it's not a good word, but what are they kind of complaining of?
Pain.
Pain, there it is. It hurts in their chest, and sometimes they can't breathe very well, and maybe some pain in their shoulder, right? So they're sort of kind of complaining. Now, when somebody's in sudden cardiac arrest, they're unresponsive, right? They're not talking with you. That's what I need you to understand, is that person that's not talking with you. And then when we take different classes, they kind of go into a little bit more what to look for. So sudden cardiac arrest, we call it an electrical problem. So that means that there's a little cell that's beating a little electric current. Yep, we're all electrifying, okay? So that's why it's imperative to get the AED. Because if somebody falls to the ground or slumps to the ground and they are unresponsive, and we kind of check to see if they're breathing, that's why this is what's going to be very beneficial to help them. And you have to do it quickly. This isn't something where we just sit and think about it. It's like, oh, is this person, I don't know if they're talking to me. We would go get the AED. Okay. This kind of spells it out on here for us. And then this one talks about potentially when you're having a heart attack. And I even actually added a little bit more information on the heart attack. If you turn your pages over, and they can get this too, talks about the heart attack. Is that, they can see this one okay? The differences between the male and the female? Down a little lower? All right. I've got my Vanna here, and you're awesome, and I appreciate you. So this is just information for you guys, simple.
Is that available from the American Heart
It
Society?
is. Okay, this is on their website because that's what I teach. So all this information is on their website. So thank you for that. Okay, So I just wanted to kind of give you a gist of when you see your person, you know, cardiac arrest is an electrical problem. So then they're going to talk, if we can see, zoom in back into this little video for everybody to watch. Did anybody have any questions for me? I don't know how they respond on the Zoom or. Oh,
Unmute yourself if you'd like, or do a chat function and it's for questions.
okay, so I'll kind of get this in. I hope it's loud enough.
At using an AED. An AED is a device that can deliver a shock to the heart of a person in cardiac arrest if needed. Even though you may be in the midst of providing CPR, once the AED arrives, use it immediately.
That's really something.
CPR combined with using an AED provides the best chance of saving a life. If possible, use an AED every time we provide CPR. During cardiac arrest, the heart quivers and stops pumping blood. An AED shocks the heart so that the heart's rhythm can reset and the heart can pump blood again. To use an AED, you simply turn it on by either pushing the on button or lifting the lid. Once you turn on the AED, you'll hear prompts telling you everything you need to do. AEDs may have two sets of pads, a large set to use for adults and a small set to use for children. Make sure you use the large pads on anyone 8 years of age or older. Later, we'll talk about using the smaller pads for children younger than 8 years old. You may have already moved some of the person's clothes out of the way to perform CPR, but you should remove all clothes that cover the chest before using an AED. AED pads must not be placed over any clothing. It's important that the AED pads not touch anything other than the person's bare skin. Peel away the backing from the pads and attach them to the person. Follow the pictures on the pads. You don't need to remove a person's jewelry as long as it doesn't interfere with the placement of the pads and isn't in contact with the pads. It doesn't cause a shock hazard to either the person being helped or the rescuer. However, undergarments should be removed, along with other clothes covering the chest, since they often interfere with proper pad placement. Plug the pads connector into the AED and follow the AED prompts. Make sure no one is touching the person while the AED analyzes the heart rhythm and before you push the shock button. If the AED recommends a shock, it will tell you to stay clear or not touch the person. If the AED tells you not to touch the person, look to be sure that no one is touching the person, including you, and state something like, stay clear or stand back, just before you push the shock button. As soon as the AED gives the shock, immediately resume chest compressions. After this demonstration, you'll have a chance to practice using an AED trainer so that you can see what it's like. You'll need to consider a few special situations when using an AED. First, if the person has hair on their chest, the hair may prevent the pads from sticking. If your AED has only one set of pads, a razor should be included. You can use the razor to quickly shave the area and then apply the pads. If your AED has two sets of large pads, you can try this. Apply one set to the hairy chest, and if the hair prevents the pads from coming in contact with the chest, the AED should tell you to check the pads. If it does, press the pads down more firmly. If they still aren't sticking, rip the pads off forcefully, removing the chest hair. Then, reapply a new set of pads to the bare skin. Water on a person's chest can also be a problem. It could allow the shock to travel through the water between the pads, ultimately preventing delivery of an effective shock dose to the person's heart. If someone is lying in water, you should quickly move them to a dry area. However, if the person is lying in snow or in a small puddle, you may use the AED. And if the chest is covered with water or sweat, wipe the chest before attaching the AED pads, but wipe the chest quickly. It doesn't have to be completely dry. Some people have an implanted pacemaker or defibrillator in the same place where you would put the AED pads. These devices look like a round or square lump smaller than a deck of cards. If you see this lump, avoid putting the pads directly over it. Also, don't place the pad directly over a medicine patch. If a medicine patch is located where you need to place a pad, take the patch off and quickly wipe the chest before you put on the pad. If you're not wearing gloves, make sure you don't touch the underside of the patch. You don't want to get any of the medicine on your bare skin. Use an AED for a pregnant woman in cardiac arrest, just as you would for any other person. If your workplace has an AED, you should familiarize yourself with it. Regardless of the type of AED, remember to turn it on first and follow the audible prompts that will lead you through the rest of the steps. Additional emergency equipment may be found in the AED, such as scissors, razors, wipes, gloves, and a barrier device. These items may also be found in a separate emergency or first aid kit. The video will now pause to allow.
So any questions on that video, other than it did look a little bit hurtful to rip those pads off, I must admit, but we have to move that out of the way, and
Got an EKG.
there you know, so we know that. So, and as we were talking about this, and I'll leave this alone here and it'll fade away. This is the one of the AEDs that we have at the college. Actually, this is what's in this building. Plus we have them all over, just like this. And there's one in Van Leer and all the other, if you go anyplace else in the college. And I pulled this out. Plus with that, I wanted you guys to see, there is a little kit that they talked about. And what was in that kit? Does anybody remember? If I can get it open here. There you go. Right. Yeah. It's probably not the best. I wanted you to see. So this would be a barrier to help breathe, just to talk about. Okay. And yeah, there is some gloves in here. Here's a pair of scissors. Here's a razor. It's not the best. Does that make sense? It's kind of like a little piece of plastic with a little piece of metal. So just something, but these are actually tools that could help you. So I just wanted to say that these are what's in with your AED. So as you can see, here's the scissors. You know, I'm not sure if everybody can see this. I don't mean to be going too fast. Some scissors. Can they see okay? And here's some gloves. And here's the razor. It's just kind of it's not the most appropriate, but it would work. So, and then here's like a towel type thing, like a good strong paper towel to actually wipe the chest off, especially if they're, sweaty or wet from water. Okay. So not that it's a very helpful kit to have with your AED. So I will put this back, and that's right alongside the AED within the, okay. So I'll set this off to the side for a second. So can I have somebody help me by chance? Are you willing to give me a quick hand? Can you see both of us in this picture?
Yes.
There we go. So if she ran and got the AED, so what's the first thing you want to do? You want to kind of unzip it for me? Kind of simple. And then if everybody can see, we got a green button, probably for on, and then this one would be if we had to shock, okay? So I just want you to turn the button on for me. Look at that.
Begin by removing all clothing from the patient's chest. Cut clothing if needed.
Okay, we even got scissors up here, kind of neat. Okay.
When patient's chest is bare, remove protective cover and take out white adhesive pads.
So I'm not going to do that for yours, only because they have to reset these, but you would pull this whole thing down.
When patient's
Okay.
chest is bare,
So
remove
I'm going to
protective
turn that
cover
off.
and take out white adhesive.
So so you can see what yours looks like. Now, here's the one that I brought to train with right here. So can you get both of us if I move over?
Yeah.
So now we're going to kind of do the same thing. This is just a trainer, so none of us are going to get hurt. Okay. So I got a razor in that one too. Do you see that? And actually there's some directions there if so the first thing we do is, what did it say to do? You have to hold that button down. Turn that on. Okay. So I'll hold this.
Apply pads to patient's bare chest.
Okay. So
Plug-in pads connector next to flashing light.
So are those the adult ones, you think? Here you go, please. So we're going to put them
Apply
on.
pads, plug-in connector.
Yep. Yes, please. Yes, please. So I don't mean to step in her way. So where's a picture show you? Oh, nope.
Apply pads.
Oh,
Plug
there
in
you go.
connector.
It's going to kind of go down here, follow his ribs. There she goes. Perfect. See? Is that good for everybody to see? We smooth it down
Apply
and
pads.
then
Insert connector firmly.
so it keeps talking.
Apply
Worse
pads.
than me.
Insert connector firmly.
Okay, want to put that in there where that light is flashing.
Analyzing heart rhythm.
Okay.
Do not touch the patient.
So what are you supposed to be doing?
Shock advised.
Make sure that nobody's touching, right?
Charging.
There we go. And it's charging. So we just listen to it, right?
Stay clear of patient.
Yeah.
Deliver shock now. Press
Okay.
the orange button.
Are we ready? So remember, nobody's touching. Okay, right? So go ahead and you want to push that little triangle.
Deliver shock delivered.
Okay, and a lot of people will move. They
Begin CPR.
okay. Now, what might that be? That noise?
Oh, it's heartbeat.
Oh, I wish. So no, actually, some people have misunderstood that. So that's why I wanted you to hear it. It's actually, if you were doing CPR right now, that's your beat. There it is, your tempo. We call it a metronome. So I would be doing it, right? Staying alive, staying alive. Terrible singer, I'm sorry. So that's what that is. So I'm not sure. I don't believe yours has a metronome. I don't know all of them. So what I wanted you to hear that yours might not have it, but you might come across one in the community that has that beeping. And I want you to understand what it is. It's not the person's heartbeat, okay? So it's going to beep for about 2 minutes, okay? Then after 2 minutes, it's going to say analyzing, don't touch the patient. So what it's doing is it's re-looking at the heart again, okay? And it may say shock advised charging, and it might shock them again. Now, sadly, we live in rural Michigan, and some people get concerned because you may shock a person 3 or 4 or 5 times. So please understand that. So once it shocks, you're not done. You have to help this person more by doing CPR. So that's why we always recommend that at least, we got to be doing compressions to help this the whole, make this resuscitation a positive one. Okay. So is it annoying? Yeah, it's pretty annoying, but I just need you to understand that. Okay. What else can I inquire with anybody who's watching? What else might be, sadly, they might have misinterpreted that beeping.
Analyzing heart rhythm.
I'll be quiet.
Do not touch the patient.
Okay, so neither one of us are touching, right?
Shock advised. Charging.
Just listen to it.
Stay clear of patient. Deliver shock now. Press the
Are you ready?
orange button.
Are you sure nobody's touching him? Okay, there she goes. Push it.
Shock delivered. If needed, begin CPR.
Okay, so it's CPR, 2 minutes, of the beeping. Okay, thank you. I'm just going to turn this off so I'm not rude. So if the person at this particular point still hasn't woke up, still hasn't kind of moved to show that there is a sign of life, you go back and do CPR. They're going to do that. Like he just expressed the fact that, ooh, somebody's going to jump. Yes, they do. Okay, some more than others, but yes, you do see that jerking, that muscle jerking. Okay, but you get back on the chest.
But is it a possibility that would be enough?
It might be, absolutely. That's right. Absolutely. We've had a few people that one good shock has been helpful. But please understand that once you put this AED on, you never turn it off or take it off. So what I mean by that, if this person starts to wake up, which we want, right? That's a good thing. If they wake up, they may, because their heart's still in a sensitive mode, they may go back unresponsive again. So leave this on until the paramedics get there to help, or the fire department, who's ever they're going to be there first. Okay. Well, now, and actually, sometimes understanding how this works helps us. We're all going to be nervous. I always tell persons, I can never make you comfortable. So please understand that. I just want to give you confidence to do something. So if we find somebody that's unresponsive, right? You just tap them. Hey, buddy, are you okay? And they don't respond to me. What should you do right then? Call for help. And then get that too. Does that make sense? But I think if I found anybody, I don't care where you are, here, in the neighborhood, maybe you're at the store, somewhere, even at church, if they're unresponsive, I'd be calling for help. And then I tell everybody, take a deep breath, and then yes, go get the AED if this one's available. Okay?
Do all the stores have that, like Walmart?
Yes, a lot of them do. Where they are, I can't tell you for sure. I know that I'm a first responder. We have a lot of first responders in our community, which is a really blessing. They carry them. I carry one in my car, when I'm not packed with a bunch of mannequins. So just inquire. And I tell persons, I have a lot of kids, my kids were in school. The schools have them. So please, normally they're by where? Where do you think they are in the school? Near the office, or actually like the cafeteria, the gymnasium, because that's where they have lots of extracurricular activities. So usually they're in that container or that little box outside of the cafeteria area or gym. Okay. So, well, I think you'd want somebody to help you, like I would want somebody to help me. So I think the more people that we have understanding where these are and how they work, it's going to be beneficial. And you can't sit there and think about it though. It's like, I'm not sure if he's doing okay. What do you think? Or what do you think? Or, 10 minutes later, if he needed a shock, it's probably not going to be the best outcome. So, but between this and doing CPR together is where we're seeing those best outcomes. So I always suggested everybody, if they could please try to get, hands only CPR. They kind of demonstrated on TV. They kind of demonstrated here a little bit, and I have no problem having persons, if you want to push on this just to feel, it does feel different. Okay. So, but this is the one that something like what we see a lot in the community, this AED, and understand that beeping is a benefit. It's supposed to help us. But one little person, because they sadly did not know how to use this very well, they've never used it. They misinterpreted the beeping as the battery was dying. So they actually reached over and turned it off. So that's not a good thing. So just understand, I don't know if yours beeps. I'm not positive, but it might. Or if you pull one at the schools or one at the library or one at Walmart, I don't know if they beep, because that's a newer feature. So I just wanted people to understand that. If it doesn't beep, doesn't mean it's not working. That just doesn't have a metronome. And I want to show everybody, if you have a second here, this is another, I'll come back this way with it. I don't know if you can see this kind. So this is kind of a little bit odd. So this is another AED. So this is actually, it's kind of a pretty bright green. I kind of like the color. Some people don't. So same thing. It's I don't have one, but it's when you open up the container to get the AED, unzip it, this is going to be plugged into it. And then when you pull the pads out, okay, they're a little different too. So that's why I bring them to show people. So this is actually, what do you think? So I want to show people, when you go to put this one on, this is going to be plugged in to my machine back there somewhere. Okay. This little, not an X, but the T goes where, if I was doing compressions, this one goes up here because you can see your person, right? And then this has got a tab. You would pull this so that it sticks, right? And then this one, kind of goes down here. This one, like you put it along the ribs. This one, actually, you would pull this one and stick it right here. Okay, so kind of neat, but everybody is used to seeing two pads. So I had one little person, he had gotten the scissors out. Yep, he was gonna cut it. So this has got a wire in it, so I think somebody might have gotten hurt. But see, I know it's, I just want you to understand that when we're nervous, people, I'm so used to seeing two pads. That's what they were, that's what the little person said. He says, I thought I had to cut that so that it would work. So this is a newer one too. But once again, I don't know who has what per se, but this would be the same thing. You push the button, you turn it on, and you listen to it, and it'll say, tear open your package, remove the pads. And then when you get these out, you're going like, what is that? So it does throw people off. So that's why I just want to give you an example of, this is something different. And this is a blessing. I hope they don't mind me using their name, but Alpena Power has these type of AED. I'm not sure if all of them are, but they have quite a few of them. And they keep them in their big trucks. So if we happen to sadly be helpful on an accident or something, I think the gentlemen are very wonderful. They would probably stop to help you. So they might have something like this. This is plugged into the device. This is plugged right into the AED, like right here. Right. It would actually, that's a great question. Yes, it would actually be plugged in. I mean, it won't work in mine, but does that make sense? So, and there's this, it's a pretty color green, but it's a good size, kind of like this one. Okay. So that's what I'm asking, is that you would, just try to, think it's a very good, strong blessing that a lot of our churches have them. So I'm not sure if anybody here goes to church. That might be something you might want to investigate.
So that one's probably the least expensive one, that one there.
Which one is that?
That one you got in hand.
I don't know.
Oh,
I know just from my experience, they were very costly. Now they're getting more, I guess, affordable. If you think maybe $1,200 to $2,000 is affordable, but it's a life-saving, right? So, and paperwork that I gave you guys also, just as I call it my little cheat sheet that I try to hand out. It talks about the AED on the front. And then on the back, actually, it's just kind of like my little picture here. So am I high enough and everybody is welcome to this. Can I go this way with it? Sure. So they're more than welcome to get this information too. I will leave as many copies as anybody would like. So, but it just talks about the AED on one side. And then I like it because it just kind of gives you some of the steps to use it.
once it's used, you've got to send it in to get new pads and do all that.
Thank you. No, you keep the device. You just have to buy new pads. Mhm. So, alrighty. And was there anybody that, I hope they could hear me okay. Was there anybody that had a question for me?
Any questions from the Zoom folks?
Any questions from you guys? You're more than welcome to do hands-on. That's why I bring this stuff for.
Now I know what's inside the little red
I
box.
guess so.
Correct. Mhm.
Never have known one thing about it.
Oh, I think it's phenomenal that they're here, and we have quite a few in our community. So, but it's members, that person that maybe you're visiting with them someplace, and sometimes people will, oh, their chest hurts. So it's like, oh, yes, there is.
Yeah, there's various places.
Sure. Sorry,
Now, if a person has the symptoms of a heart attack, you don't want to use that, right?
because there's why
If you don't need it.
right now they don't need it is right. Would I go get it? Because I might be concerned if they're having a serious enough heart attack, they might go unresponsive. Yeah, I might.
To go on responsive.
That's when you use it. Absolutely. Right. But it wouldn't hurt to have it beside him kind of discreetly, right?
How do you know that that person who is unconscious is having a heart attack?
Well, now once they go unresponsive, it's just in the it's assumed that they are in sudden cardiac arrest. Yep.
But it doesn't hurt you if you're not having. a heart attack
Correct.
to do that.
It does not. It does not. Now, if I wanted to right now, by no means, I'm not trying to be, if I took this and opened it up and put it on myself right now, it wouldn't advise a shock. Because it can, that's right, because my heart is, they call it it's beating regularly.
Okay, so if it detects a regular beat.
Then that's when it would put, right.
But you still have to replace the pad.
Yes. And sadly, they are, those are what's kind of expensive. They probably cost, and I'm guessing, I only know mine from my fire department, they cost about $80 a set. And then you can only use them one time. Especially if you rip off the hair, right? You can't use that one again. Sorry. Yeah. But that's what you have to do. That's why I kind of showed you that. You know, you got to kind of wonder. And everybody that goes unresponsive and potentially your team is doing CPR, I hope somebody is, when they're unresponsive like that, we would make the assumption that you want to help them and you would do something about it. And then you have to expose them. When for all intents and purposes, if you're what we call dead, modesty goes out the window. So to make sure that we're doing good CPR and getting it ready to put the AED on, we expose everybody. I'm not trying to be silly, but we have to be, I want to know exactly where my persons, you guys are putting your hands, and you need to see exactly where to put that AED. Now give me the question, if anybody's listening, wonder if they might be able to tell us, the Zoom persons, pacemakers or defibrillators, right? In my video, where are they normally? Well, where's my heart sitting? On the left. I don't mean to tap that. That's probably driving them crazy, right? So my dad has one and it's on the left side. Okay, I don't know if anybody has one. Now, sometimes these malfunction, they do, and they had to take it out and put it over here. Now, there's a few people that have them on this side, which is wonderful. They actually ask their doctor to put it on that side. The reasoning is a lot of our avid hunters in our area, you know, if they have to shoulder their weapon on the left side, they will actually have their defibrillator put on the right side. Kind of makes sense. Okay. But if I have one on my, take this off real quick. I won't step in everybody's way. But if I have the defibrillator, my pacemaker defibrillator, if it's on this side, okay, how about you help me? Can you help me? Yeah. So we know where this one goes, right? So go ahead and put that one back on, right? It shows you the picture, kind of like right down here a little bit. Yeah, here you go. Okay. Now this one, it tells you to come up here by your collarbone, right? But now I have a pacemaker there. Now what? There it is. Perfect. You want to move it down just enough, probably a little bit more, just so that you don't cover it. Does that make sense? Because that's kind of like metal that's in there. So we just suggest that you're going to lower it a little bit. And actually, what he did is almost like you kind of aim it towards your armpit. Just don't cover that. Because if you were to cover it, it's metal. And I don't want anybody to get hurt because, and actually, if the energy, the metal, all my electricity goes to that pacemaker, that's probably not working. Because if somebody is unresponsive and you're doing CPR on them, that's probably not working correctly. So you have to use the AED, just like they've taught you in the video. You have to use it to help them through this episode with their heart, the arrhythmia that the heart's in. Okay, so that's pretty much how you would put it. Just kind of look at them. It's like, oh, I know what that is. I'm just going to lower that down a little bit and maybe aim it more towards the armpit. So questions for anybody? Any other questions? I just want to.
Any questions online?
Thank you very much.
You did a good job.
You're very welcome.
Thank you. It was very
Thank
well
you.
done. Appreciate it.
Thank you. Oh, absolutely. And remember, that's information just to kind of keep it in the back of your head or in the front of your head. There we go. And please let the other persons know that I have these for them too. Oh, absolutely. You can take a few for everybody if that's okay. I made them for you guys. So
Well, we did have a message from from Tom Hilberg.
Sure, I'll try.
The AED costs are about $12.75 to $28.75.
There you go.
Life's about 8 years. Battery life is 2 to 5 years.
Correct. How much do the pads cost? Did he ask? Did he find out?
No, I
Yeah,
didn't
please.
find that out.
Okay, that's okay, because I know those can be, because they only last, they're only good for a year. So
Okay.
that could be just a thought.
So.
I just Googled AED costs and that's
Thank
what I
you.
did. And
Thank
Google's never wrong.
Oh, exactly. I should have known.
So these things like a fire extinguisher where once a year somebody comes around.
Yes,
Make sure.
yes,
ACC manages the one that's in
right. Sometimes it's a little more frequent than a year.
Yeah.
So I don't know what, I mean, I know ACC does, you know.
Checkbox.
Yeah,
This was inspected.
there's something, I'm sure, you know, they tell you to follow the manufacturer's recommendations once a month, once every 6 months, once, you know. Well, thank you for letting me visit with you guys.
Thank you.
You're welcome.